And psychologists say that the fear of the unknown is one of humanity's greatest and fundamental fear, perhaps even more important to their behavior than the fear of death. Welcome to Success Confidentials.
9 minutes every week that'll level up your practice. If you're a healthcare visionary obsessed with patient experience, team culture, marketing, and growth, you're in the right place.
We are too. We're Lauren
and Christine,
the patient whisperers. We worked together for 4 years as leaders in a real premium practice.
We did not play in the traditional healthcare sandbox and believe human emotions drive all success, and it really, really worked. We grew our cash pay practice an average 60% year over year.
And on social media, we grew our followers from 1,000 to 14,000 in just 2 years, generating millions in annual revenue from social media alone.
So now we're out here sharing what made us wildly successful so you can be too.
Let's have some fun.
Let's dive in. Today, so I'm excited about this topic. We're talking about the question that almost everyone ends their encounter with patients asking. And we see this from phone calls to counselors, to doctors, surgeons, estheticians, nurses. When we are in a counseling or consulting type of moment with a patient, this is the question that almost always is used to end the encounter. And it is, do you have any questions?
Or do you have any other questions? The problem is that this question is too broad and actually kind of paralyzing to our patients.
The right question will actually uncover why patients aren't converting. The first question does not.
This conversation will help you understand what's holding your patients back from converting and know how to be a better guide when counseling your patients.
It'll also ultimately increase conversions for those premium services and offerings, which of course we all want. And this is something that we go over in every single one of our training sessions with all staff members because it's that important. I think back to in our own practice when we really started looking at our numbers and our conversions. And we saw that there was a gap in conversions when patients were in our practice, specifically for consultations, considering premium procedures. And our doctors and counseling professionals would often feel like the patient was ready to go. They're done with their part of the consultation. They hand them off to the counselor or scheduler, and they're like, this was a slam dunk. They're ready to book. Then the patient gets to the scheduler and they don't book. And they say, well, I need to go home and think about it. I'll get back with you. So we identified this little gap and we were like, okay, what is happening here? So I spent a lot of time sitting with our counseling doctors and watching the process and watching the patients and watching that handoff to the schedulers or counselors. And what I noticed was that all of our doctors were using that question at the end of the consultation. And they were saying, do you have any other questions? And patients would typically say, no, I think I'm good, and then walk out. The doctor would think, okay, great, they're ready to go. So what we changed, I decided to try something. And so I worked with each one of our doctors and I said, okay, when you're done counseling a patient, instead of asking that, let's try something new. We're going to ask, so do you have any hesitations or concerns? Sounds like a very simple change. Like, what's the difference? It sounds the same. You would be shocked. We were amazed at the difference. And I would sit there and witness this in the beginning as I was helping coach them. Patients would say crazy things that you would never know. And so all these unanswered questions and hesitations and concerns that patients had, that they weren't raising their hands and saying, I have these. They were just silently going, okay, this is the process. I'm a candidate, and moving on to the scheduling, but they weren't ready to schedule yet. And no one knew why. That question was really empowering because then the doctor was able to counsel the patient on that hesitation or on that concern. And that was a game changer. We immediately saw conversions increase in our practice.
I remember us talking about this in practice, and patients would say things like, I want to go do more research, or how many procedures have you done? Will it last? What are the risks? How happy are your patients that have this procedure done? And it really uncovers some of the fears that they would go home with,
Yeah.
ruminate on, and then ultimately decide maybe this wasn't the right path for them because they didn't feel like they had the expert in front of them to answer that or ease those fears in that moment.
We really have to uncover those hesitations and concerns when they're in front of us before they go home or we've lost them.
We have to remember that patients don't know what we know as healthcare professionals that are living and breathing our specialty every single day. And psychologists say that the fear of the unknown is one of humanity's greatest and fundamental fear, perhaps even more important to their behavior than the fear of death.
It's so easy to forget that. And we have uncovered 14 reasons why premium patients procrastinate after the consultation when they're deciding whether or not they should have this premium service or procedure. And you won't know which one of those affects this particular patient unless you ask this kind of very specific question. So today's takeaway is just replace "do you have any questions" with "do you have any hesitations or concerns?"
And bonus, make sure to make eye contact and truly listen to what your patient is saying. You will be amazed in the difference it makes for converting patients in your practice.
As always, we do not leave you without resources. We have a complete training program that really tackles soft skills for our entire team, from front desk phones to surgeons, doctors, medical professionals, that really digs into all of these soft skills that make a huge difference in converting premium patients, forming a better connection with our patients, and growing our practice. If we can help you with anything related to today's topic, use the link to schedule a free 30-minute synergy session just for new practices.
For our existing practice clients, you already know where to find us.
Now we want to hear from you. What resonated? What other topics are hot for you right now? We want to know all about it in the comments.
We're just a comment away, so if you have any questions, we personally respond to all comments and DMs. If you're not subscribed yet, make it easy on yourself to see new episodes and reference topics that are helpful by hitting the subscribe button.